traditionally nicknamed as a destroyer of sugar. It supports the pancreas for insulin production. Thus, it is beneficial for both diabetes type 1 and 2. What is Gymnema? Gymnema or Gymnema sylvestre is native to the tropical forests of central and southern India. Nearly for 2 millennia, Indians using it as a natural diabetes treatment, they nicknamed it as a destroyer of sugar. Additionally, it reduces the taste of sugar, thus you can use it for fighting sugar cravings. Gymnema, commonly known as mesashringi or Gurmer, means sugar destroyer, because it masks the body's sense of taste to sugar. It supports the pancreas and insulin production in type 2 diabetes. It improves the ability of insulin in lowering glucose level in both type 1 and type 2 diabetes. Additionally, it decreases cravings for sweet. This is a substitute for oral blood sugar lowering drugs in type 2 diabetes. Other common names for Gymnema are Gokhr Unani, Gurmer Hindi, Mesashringi Sanskrit, Sarukirantan Tamil, Vishani Sanskrit. Gymnema lowers sugar level. The hypoglycemic action of Gymnema leaves is slow in nature. Instead, the prescribed hypoglycemic drugs have the rapid effect. It raises insulin production by regeneration of the pancreas cells. It improves glucose uptake by the cells by increasing the activity of the glucose-utilizing enzymes, and stops adrenaline from stimulating the liver to produce extra glucose, thereby controlling blood sugar levels. Gymnema leaves can additionally useful in lowering serum cholesterol and triglycerides. It also reduces the taste of sugar and craving for sweets. The leaf extracts contain gymnemic acid, which inhibits hyperglycemia and acts as a cardiovascular stimulant. Medicinal uses of Gymnema. Therapeutic benefits of Gymnema sylvestre are: it has been in use for thousands of years as an herbal treatment for diabetes. It can block the absorption of glucose from the intestines and helps to reduce cravings for sugar. It has also suggested for herbal weight loss applications. Chewing the leaves, or taking it in capsule form, can alter the taste of sugar and reduce the sweetness. It reduces fat storage from carbohydrates and increases the amount burned for energy. This leads to a reduction in fat stores and increase in energy available. It may reduce the amount of triglycerides and LDL bad cholesterol in the bloodstream, thus risk towards cardiac problems in reduced. It has slight diuretic effect, useful to treat water retention and may help lower blood pressure. It is useful to treat stomach ailments, constipation, and liver disease. Rheumatoid arthritis and gout have also been treating effectively. It also has antibacterial and antiviral properties in liquid applications. Gymnema dosage. General suggested dosage is 400 to 600 mg daily of an extract standardized to contain 24% gymnemic acid. Dose, 500 mg per milliliter or 30 drops tincture. Otherwise, you can take as an infusion of dried leaf of 6 to 10 grams per day. Gymnema availability. Gymnema is commercially available as dried leaves, leaf tea bags, dip tea bags, powder, extracts, tablets and capsules. How do you take Gymnema? Gymnema sylvestre is very much bitter and tastes difficult to consume, so you can boil leaves along with green tea and filter it. If needed, sweetened it with stevia and flavored it with any herbals such as cardamom. Have a very nice cup of medicinal tea that lower blood glucose. Bioactive constituents of Gymnema. Bioactive constituents of Gymnema sylvestris are olein type of triterpenoid saponins called gymnemic acids. Gymnemic acid contains several acylated tiglyl, methylbutyryl derivatives of decyl-gymnemic acid DHGA, which is 3-O-glucuronide of gymnemaginin 3, 16, 21, 22, 23, 28 hexahydroxylene 12-in-2. The individual gymnemic acid saponins include gymnemic acids, IV, gymnemosides AF, and gymnemosaponins. Gymnemic acids have antidiabetic, anti-sweetener, and anti-inflammatory activities. Possible side effects of Gymnema. When taking an appropriate dosage, Gymnema is safe, although extensive studies have not performed. One obvious risk is that if Gymnema is successful, It may lower blood sugar levels too far, causing a dangerous hypoglycemic reaction. For this reason, medical supervision with frequent blood glucose monitoring is essential. Gymnema scientific evidence in diabetes control. A study titled Gymnema Sylvester for Diabetes Mellitus conducted by the Journal of Alternative and Complementary Medicine 2007. 13-9, 977-983. This study result shows that Gymnema targets several of the etiological factors connected with diabetes. This includes chronic inflammation, obesity, enzymatic defects, and pancreatic beta cell function. There is no single oral hypoglycemic drug presently exerts such a diverse range of effects. Gymnema may be useful in the management of diabetes and the prevention of associated pathological changes, says the author. A study titled Gymnema Sylvester, a memoir conducted by Connector P. R. Kamat and published in Journal of Clinical Biochemistry and Nutrition September 2007 41-2, 77-81. This study results show, the active compound of the plant is a group of acids termed as gymnemic acids. It has observed that there could be a possible link between obesity, gymnemic acids, and diabetes. This review will try to put forth an overall idea of the plant as well as present a molecular perspective linking the